Across the country, CNA and NNOC nurses are working to transform healthcare. Nevada RNs are part of this national movement to improve the lives of all Americans. Last year, Nevada nurses took to the road on CNA and NNOC's Nevada Healthcare Roadshow bus to compare the candidates' views on healthcare and demand healthcare for everyone.
Enough is enough. I am tired of seeing my patients being denied health care and having to come into the emergency room for just basic care. And I'm tired of seeing people that have insurance being denied care and they're dying.
We should all have affordable and quality health care insurance.
While on the road, they visited cancer survivors in Fallon, Nevada, where a cancer cluster has changed people's lives.
Literally had water, free water to put in the schools, and the school board denied it.
And visited the Shoshone Reservation near Ely, Nevada, to hear about healthcare challenges on the reservation.
We provide healthcare to our employees, but no way does $5,600 or $5,100, that does not cover healthcare coverage for a family.
Right.
Even though we do have Indian Health Service, that's not enough.
Right, it's not.
We are constantly on priority 1. Priority means only extreme emergencies.
Right.
That's what.
So you're not looking at preventative health care, you're not looking at prenatal care, you're not looking at all the things that could cut costs so much.
That's right.
This is like nurses from Nevada, that's what we want to turn it all around.
At the end of the tour, RNs gathered to talk about the importance of RN to patient ratios.
My name is Alayo and I work at San Martin Hospital in the intensive care unit.
Charlotte Tyler, I'm a staff nurse at San Martin Hospital here, St. Rose Dominican Hospital in Las Vegas.
My name is Michelle, I work at St. Rose San Martin.
My name is Al Bose and I'm a telemetry nurse at St. Mary's Regional Medical Center in Reno, Nevada.
I'm Angelique Kennedy, I'm a pediatric nurse at St. Mary's in Reno.
Basically, the reason that staffing ratios are important is because nursing and medicine and patients have gotten more complex, and so you need to spend more time with each patient, and with ratios that allows you to do that instead of just doing the bare minimum tasks to make sure that your patient's getting through the day.
Staffing ratios are really important to nurses as well as patients because we need time to spend with the patients to educate them as well as take care of them. And if we have too many patients, then we become overwhelmed because we're only human, and we can't take care of them the way that we were taught to and the way that we want to.
Kids get well fast, they get sick fast. So if they come in, they're usually pretty sick, and you have to spend a lot more time with them. You have to monitor a lot more of their oxygen because they can't keep it in their nose. You have to tape it to their face. There's a lot of different things that come into play that the nurses have to do. And if you only had 30 seconds or 10 minutes, with them, you would never be able to get all of that done. That child would get progressively worse.
Across the board, national staffing ratios would be quality for everyone. Everybody's deserving of the best, and that's who we're for. We're here, we're helpmates. We're here to take care of everybody. We want the best care that we can provide for everybody.
Having good patient care consistently, I think, is important, and you never know where you're going to be when you need, care. I think having some type of a standard nationally would help, help us have that consistent, health care.
Patients deserve good care and quality care no matter where they are in this country. This is the United States of America. We deserve better.
Why should one state have better nursing care than another state? We want everyone to have good nursing care, good health care, so it should be national because everybody deserves the same kind of care.
And this year, nurses fought for the right to organize for a better union, a democratic union that truly represents RNs and their patients. CNA, NNOC.
That the nurses here at St. Rose Dominican Hospitals did not have a voice.
When we first started this movement about 5 or 6 months ago, I'm very pleased to say it has spread all across the valley for Las Vegas. Other hospitals are interested in joining us, UMC, Mountain View Hospital, and the other St. Rose nurses.
Recently, nurses from the University Medical Center in Las Vegas told us why they support CNA NNOC.
Fighting for the nurses' rights means fighting for patients' rights also. You have good wages, you have the morale is better, you have better working conditions, staffing ratio, the patient gets better care if you have better staffing.
The California Nurses Association, we can achieve patient advocacy through collective bargaining. It's been my experience over the years that the needs of the professional nurse have not been attended to by the current union, and that in order to improve our standard of practice here at this hospital and throughout the state of Nevada, we really need to be a part of an organization that's looking at the practice issues that affect registered nurses.
We all have relatives. We will all become sick one of these days. And do you want to lay in a hospital bed where a nurse is running with 10 patients? I don't. And so what are the nurses in the United States going to do? Because it isn't the big billion-dollar companies that give a hooey about us. They don't. We need to unite with other nurses to bring our health care back to what it used to be.
Healthcare for everyone, protecting patients, working together to uphold the standards of the profession. Nurses across Nevada are choosing the CNA NNOC difference. Join us for a better Nevada and a better world.